Hello, hello, and happy Thursday. Welcome to another edition of Thriving Thursday. And I am your host, Dr. D, also known as Dr. Dewan Carpenter. I am a board certified physical medicine and rehabilitation physician, also focusing on lifestyle medicine. And I help busy people to refocus on their health and well being so that they can eliminate the chaos and thrive once again. And today, our title is Caring for You is Killing Me. And before I go any further, please make sure that you like and subscribe so that we can continue to get our message out to other people. All right. So thank you for joining. And we're just going to get right into it. The reason that this video is important right now is we are at the start of the National Physicians Week. And of course, when you think about physicians, you think about people who are caring for others. Most of my videos have to do with questions that I've gotten from patients, and I turn them into a video in case there are other people out there who have the same questions. And while today is a little bit different because I have not specifically had this question, it is something that I have noticed day in and day out, time after time in my practice from patients. Okay. So when you think about being a caregiver or caretaker, you are responsible for helping someone else. And oftentimes that can be something that's not easy. I can tell you, as a physician, it's not always easy to care for other people when you are not at your best, when you maybe don't feel as well, maybe you didn't get as much sleep. Whatever the case may be, it can be challenging. And so, what I find often in the rehabilitation hospital is I come across women, especially, who have been the caretakers for their families. Now it's just them and their spouse or significant other, and they're still caring for them. Yet they are dealing with their own health challenge and find themselves in the rehab hospital, and oftentimes, the first thing when I meet a patient, I introduce myself. Hello, I'm Dr. Carpenter. I'm the rehab physician. I'll be taking care of you while you're here. Almost inevitably, the first question they ask me is, how long am I going to be here? It is a valid question because who doesn't want to go home? But most of them follow the question with a statement because my fill in the blank is relying on me, or I need to look after so and so. I need to do this, that, or the other. And while that may be true, if you yourself need looking after and need some care taking, how can you then still fulfill your roles of taking care of someone else in your home? So, just a few points that I want us to focus on. And, this is also for any physicians or healthcare providers, nurses. If you happen to be in the healthcare industry, this really is for you, but especially for my physicians out there who may watch this video, it is important because you have to be able to pour into yourself before you can pour out, right? I use this analogy all of the time. If ever you have been on an airplane, you know that one of the first things that they tell you when you get onto the airplane is in the case of an emergency, should we lose cabin pressure and oxygen masks are required, one will fall down, and please put your oxygen mask on first before you help others. That means you need to have your own oxygen in order to be able to help others. The same applies if you are a caretaker or a caregiver. You have to provide your own care before you can provide care to someone else. So, first point that I want to make is being the strong woman is overrated. You do not have to be strong. And really honestly, let's redefine what being a strong woman is. And certainly this applies to men as well. I'm focusing on women in this video because 90% of the time in my professional and personal experience, it ends up being women who end up having this kind of guilt or burden of taking care of other people to sometimes their own detriment. And so here we have the strong woman, right? Being strong doesn't mean that nothing affects you. It doesn't mean that you continue going until, you're bleeding and battered and bruised and all of that. That's not what it means. To me, okay? And in my, again, professional experience, it's being strong is being able to recognize when you need help. It's being able to recognize that I'm at my capacity and I can no longer assist in that way. It is saying no and letting no be a full and complete sentence with no explanation, no anything else needed. It's just no. Okay. Um, that is how you be a strong woman or a strong person. Um, you don't have to just continue pushing forward, putting your head down and grinding. I will give a brief personal story because I can say this with confidence because I know it well. So, if you recall during COVID times, right, everybody everywhere was kind of on edge, stressed out. I know for us in healthcare, especially in physical medicine and rehabilitation in the inpatient hospital, nothing changed in our lives in terms of our day to day. There was no stay at home. There was no, trying to figure out what work looked like now that we were confined at home because I wasn't. So I was continuing my everyday routine. The only thing that changed was I didn't have kids to drop off or pick up. And certainly the traffic was pretty much a breeze, right? During that time, I actually started to have some of my own issues. I started having some pain in my legs, but I kind of ignored the pain because I'm like, I have things to do. I don't have time to go see about it. Let me just take a little bit of ibuprofen. I'll keep it going, keep it moving. And one ibuprofen turned into two, turned into three a day, turned into I'm popping ibuprofen pretty much nonstop to get through the day. And long story short, I ended up finally going to see a doctor. And the crazy story is I dropped off the kids at daycare at that point, went to the doctor's appointment, and I was going to go to the doctor's appointment and then go on to work. When I was in the appointment, I'm examined and everything. She's like, "Do you work today?" I said, "Yeah, I'm going to work after this." She's like, "No, you're not." I said, "Yes, I am. I'm scheduled to work today. I'm going to work." She said, You're not. So I will call whoever I need to call, write whatever letter. You will not be going to work today or any other day." I'm like, "You got to be kidding me," right? So the long and short of it was I put off my own symptoms trying to be the quote strong woman because I didn't want to, I felt I would be a burden to my colleagues and they would have to pick up my slack from taking care of myself. Number one, that's what they are there for. We are all a team. We're, supposed to help each other. It works both ways. I had to cover for somebody when they suddenly got ill. It's kind of what happens, right? And if you need to take care of yourself, you need to take care of yourself. Because quite honestly, no matter what job you're in, if you, God forbid, fall over dead on the job, they're going to walk over you, get you out of there, and try to find somebody to fill your position as soon as possible. That's not being pessimistic. It's being that at the end of the day, the business still has to run, right? And so if you are not concerned and taking care of you, why should anybody else? So let's get rid of really what this kind of idea of being a strong woman actually means and get some help. Make sure that you are taking care of yourself in order to be able to give, right? You can't give when you don't have anything. If my hand is closed, nothing goes in, nothing goes out. But if my hand is open, things come and go freely. And that's exactly what we need to do. So, number two is important. If you're going to care for yourself without allowing caring for others to literally kill you, you have to be able to be self reflective and introspective. What do I mean by that? It's important that you are aware of what you need and when. Um, Everybody needs rest. We need water. We need bathroom breaks. Even though those things may sound very small and minute and trivial, oh, yeah, we know all of those things. But how many times have we actually put off some of those things because something else at the time seemed to take priority? So often what happens is we get caught up in our everyday of the list of things to do and our titles and our responsibilities and our tasks and our checklists. And we don't stop and check in with ourselves. Hey, how are you doing today, Dr. D? What do you need for today? Does today need to be a little bit lighter day because you have some things on your mind or your heart? Do you need to set up a counseling or a therapy appointment? Do you need to go to bed early? Do you like all of those things are checking in with yourself to ensure that while you are caring for whoever or whatever you have to care for, that you are recognizing what it is that you need. Number three is also identifying what stress can look like, especially if it's chronic. So many people equate stress with a feeling. I don't feel stress, so therefore I'm not. And that actually can be a very big misidentification, especially if you are someone who is a caregiver or caretaker. Most likely you are experiencing chronic stress, at which point you don't have all of the physical manifestations of maybe your heart racing, feeling this sense of, loom or doom. You don't have that because your body has now been accustomed to this chronic stress. So, even from a physiologic standpoint, your body can manage stress and increase the cortisol levels until whatever that stress has passed by, right? Until it has dealt with. But when you are in a state where it is chronic and continuing and ongoing, now your cortisol levels are high and they remain high where they should be up and down based on what is happening. When your cortisol levels are high, it starts a whole cascade effect. Many people are most familiar with the fact that it increases your glucose levels. So if you happen to be someone who is diagnosed with diabetes, then you may notice that your sugar numbers are higher, but your diet hasn't changed. You haven't included any other sugars. And that may be a little confusing as to what's happening. Well, if your sugar is increased, and now we have this, you end up with the insulin kind of fluctuating as well. So now you got high sugar, the insulin is trying to combat that. You also now start to get insulin resistance. And when we have all these things going on, then we can develop heart conditions or predisposed to more heart stressors. We also end up gaining weight and you start having these cravings, and it ends up being this horrible cycle. And now we're back at the point where I just don't feel right. I feel fatigued and I'm not able to do all of the things, but I got to take care of this person over here and this job over there. It's a continual ongoing cycle. And it's not good. It can lead to a lot of long term problems, obviously. But I can tell you one of those things, it also can lead to or it increase your risk of developing a stroke. I just saw somebody, similar situation, in that the first thing was, well, I don't feel stressed, but blood pressure is through the roof on multiple medications, difficult to control. And they meet me because now they've had a stroke, right? And so dealing with the things that you have to do in life, if you have to work, if you are a parent, or maybe you are caring for a parent, all of those things, we understand that those are things that need to be dealt with. But we also need to look at what are those things doing to us from a personal perspective, and are we actually recognizing that we are in a mode of chronic stress, and what can we do about that, right? So it kind of goes back to what I said before about the self reflection and recognizing what it is that you need. I will tell you, as somebody who is a high achiever, kind of, check the box, give me a list, and I'm going to go through that list until everything is done. It used to be if that meant I wasn't gonna sleep, or if I had to cut some stuff out for myself, I would go ahead and do that. And again, this situation that I had, this medical situation where I got pulled off work, actually ended up being way worse. Okay. I was literally a foot away from being hospitalized. The only reason I was not hospitalized, my doctor said, was because she knew I was a physician and she believed that I was going to follow her instructions and do what she said to do. My chronic stress and inability to recognize what I needed and when almost cost me a hospital stay, or worse, could have cost me my life because I was that sick that I didn't even recognize it. Okay. So the last thing is, how do we cope with this? When we do have obligations and things that we have to tend to, we are in relationships, marriages, um, parents, we are adult children caring for ill parents or aging parents. All of those things are important. But how do we cope? How do we master and manage what we need to do to keep ourselves healthy and keep our cup full while we are caring for others? So, this is not in any particular order, but some of the ways that you can do that is therapy. They call it therapy for a reason because it can be therapeutic. A therapist, a trained therapist and counselor can recognize when you are in a state of chronic stress, when you are in survival mode. That's been me. I've been in survival mode and did not recognize that I was in that state. Again, chronic stress. So it becomes the new normal because now your body has just adjusted that, okay, this continues to come at me. We just gonna do what we gotta do and adjust. So therapy is one way that you can cope and make sure that in caring for others, you are caring for yourself first. Exercise is a great way in order to definitely manage stress, but also to to take care of yourself, making sure that you are getting your heart rate up and going for 20 to 30 minutes every single day in some way, shape, or form. Doesn't have to be all 20 minutes all at one time, all 30 minutes all at one time. You do what you can and you make it work. But exercise is helpful, one, for the body to make sure that you are getting your heart pumping and keeping it working. It's important in helping to release those feel good hormones that everybody talks about. When you work out, you actually release, the body releases those endorphins and things. It helps you to feel better, have a better overall sense of well-being. It helps to decrease pain. It helps to reduce stress. It does a lot of different things. Okay. Um, Also, diet. So when people are stressed, many people end up stress eating. So we're grabbing, fatty, salty, sugary things that again give us those feel good hormones, but have lots of terrible effects down the road. Remember, I said chronic stress increases your cortisol, and cortisol then increases your glucose. And your glucose triggers insulin to be reduced, to be released, which then once insulin is released, trying to get the glucose down, now we become resistant to the insulin, which then predisposes you to weight gain on top of the sugar that now you grabbed, and now you got the sugar elevated. It just creates a whole endless cycle, right? So diet, and not a specific diet, but changing your eating habits so that if you happen to be snacky, that you have healthy, good for you snacks that also will help to reduce stress. For example, antioxidants, foods that are rich in antioxidants. Berries are one good example. They help when you are stressed because your body releases these oxidative radicals. And so antioxidants help to combat that. These radicals kind of go through and cause damage, they cause inflammation. So, you can experience increased pain, it causes difficulty sleeping, all the things that you need. And you're trying to care for someone else. It's not going to work when you are operating on fumes, right? So, preparing in advance, making sure that you are balancing what you're eating, eliminating the the added artificial sugars. You have to be careful of natural sugars as well, certainly, but it's definitely the added sugars. And having healthy, good for you snacks that help you to eliminate that snackiness that you may have without causing more damage. Um, Focusing on daily self care. I talked about this in a prior video about what exactly is self care. Self care is not a trip to the mall. While that could be part of it, retail therapy is not daily self care. I'm sorry. It's just not. Self care is something that you can do every day that fills your cup, that recharges you, that allows you to be able to handle and manage the things that you have to do in your day, right? I gave the example in that video that if you are a parent, you're not taking care of your kids, you're not caring for them once a month or every other day or a couple, once every 2 weeks. You're caring for them every day because that's what they need. Well, so do you. Daily self care. You have to figure out what that is for you. If you happen to struggle with that, please go back and watch that video. I give a lot of really good examples and things for you to start there. What else can you do to cope so that caring for others is not literally killing you? You can actually focus on setting aside some quiet time in every day. I think definitely in the society that we live in, there's hustle and bustle all day, every day, from, phones going off, from phone calls to text messages to emails to everything is at the palm of your hand where people can get to you anytime, every time is not always a good thing. So having some quiet time, maybe at the end of your day, is good. Listen, if you got to sit in your car in your driveway before you come into the house just so that you have that quiet time, do that. Stop down the street. Whatever it is that you need to do, having some quiet time also is a time when you can focus on what you need, as I said before, in self reflection, looking at, man, today was a tough day. What did I need today? What do I still need today to help make it not feel so heavy? Right? Quiet time is important. Prayer and meditation that may go along with your quiet time. But prayer can help. Um, Setting them out, and whether it's praying out loud, calling a friend to pray with you, praying in a group, whatever it is. Some people write down their prayers and fold them and put them in a little box, and whatever that means to you. Again, meditation can be taking a particular passage or a scripture, or positive um positive reading that you may have come across, and meditating, really thinking over that in your time, that can help to change how you feel about the situation, can give you some additional insight, some additional inspiration. And one of my other, kind of favorites would be take yourself on a date. Just you and you doing whatever it is that you like to do. Take yourself out on a date. It's important to spend time with you, to spoil you, to do whatever it is that you like to do it for you. That covers this kind of brief, let's see, covers the my kind of brief points and takeaways for how to care for you instead of allowing your care for others to be what is killing you. All right. So, again, I'll go over just the four things really quickly. Redefine this whole idea of strong woman. Make sure that you are doing some self reflection and introspection on what it is that you need. Number three is identifying what stress looks like for you, especially if it's chronic and you've been dealing with a lot of things. And then number four, finding ways, not just one way, multiple ways to be able to cope and manage when you are a caregiver or a caretaker, so that caring for your loved one, caring for whoever or whatever it is not killing you. Thank you so much for tuning in to this video. I really appreciate it. And again, don't forget to like and subscribe. And I will see you guys on the next time. And as always, please make sure that you take care of yourself and focus on being well so that you can stay well. All right.